available to seniors who do not have enough income to cover all of their healthcare costs. Before we start, though, I would like to take a few minutes to go through our navigation panel on Hop-In. So the first thing that you will see over here on the left is a big red 1 with a rectangle. The very top icon is the logo for Hop-In. You do not need to do anything with that. The next one is the reception area, which looks like a little house, and that is where we will start. Everyone who signs in starts there. The next one is a camera, and when I start speaking from the stage, you will see this blue light go on, and that will tell you that we are at the stage, and that will be the presentation. The next one, it looks like a little tent, and that is where the expo is. That is where the exhibitors will be. In addition to that, we have over here on the right a big 2, and there is a chat in that box as well as polls. And if you wish to send us a message either in the reception area or on the stage, basically it will go in this chat. And the way that you do that is you go down here to the number 3 in that box, and it says start typing. Now we have moved to the stage, and as you can see, the camera has come on. You can also see that in the center here, it says that this, we will start speaking in about 5 days. In this instance, it'll be a couple of minutes. And then over here on the right, again, we still have the chat in the 2, and we have the typing in the 3. And then the next one after I finish speaking is that we will go to the expo. As you can see over here on the left, the little tent has come on in box number 1. This diagram or tent square rectangular thing in the center says CGS. The one below it says Integrity Insurance. The one below it says Humana. And while we are here at the expo, I would like to thank our sponsors today, who are Humana, Kaiser Permanente, Integrity Insurance. They will have representatives at their booths. In addition to that, our colleagues from the Centers for Medicare and Medicaid Services have joined us as well. When you click on the booth or the expo, the outside, it takes you to the booth or the inside of the booth. As you can see over here on the left, the little tent is still lit up in the 1. If we move over here to the right, we can see this big 2. Now the word booth appears in the box with chat below it, as well as polls. So if you want to ask someone a question while you are in the chat, you can again type in there, and that will then go to that booth person who is moderating that. If you want to share your audio and video, you click on the 3 down here in the middle of the screen. As you can see in this particular demonstration, Cigna is the expo participant that is being highlighted. Gives you a little bit of information about them. Gives you an event offer. If you would like a free one, you can sign up for that. In addition to that, if they are offering any kind of promotions, you can click in box number 4. Be sure to look at the polls. Those are asking questions specifically about different services and programs that are being offered and whether or not you are finding this information useful. With that, then, we're going to go ahead and we're going to start the Medicare Lunch and Learn today. So the first thing we're going to just review very briefly is how do you get Medicare? You get Medicare basically if you're age 65 or disabled, and if you have paid in 40 quarters of Social Security taxes or FICA, or you have been married to a spouse for 10 years or more who has paid into Social Security and FICA. It's important to know that under Medicare, we have parts and we have plans. Now, Medicare has 4 parts A, B, C, and D. And we supplement Medicare with plans. And we have Medicare Advantage plans, we have Medicare supplement plans, and we have prescription drugs. Very briefly, Medicare Part A is hospital insurance, a little bit of skilled rehab services, a little bit of skilled home care and hospice. Part B is medical services. This includes things like physician visits, labs, x-rays, emergency rooms, preventive services. Part C is Medicare Advantage, and we'll talk a little bit more about that. It is optional, but that is basically either an HMO, a PPO, or a private fee-for-service, or a special needs plan. And Part D is prescription drugs. Just briefly, I want you to take a look at the Medicare card if you have not done so. You get it at age 65 if you receive Social Security. If not, you have to sign up with Social Security to get your card and also to be registered. You have a number here, which is basically a scrambled number. And then it shows on your card that you have hospital Part A and medical Part B. And then it also shows what date your coverage starts. And the reason that we want to look at Part A and Part B is as we go through this, that will determine whether or not you are eligible for Medicaid to help you with some of the costs. So with that, we'll turn to Medicaid. And the first thing I want you to do is, as I go through these different boxes, I want you to identify yourself as a different color. So if you are a supplemental security income person, an adult Medicaid, long-term care, a PACE, or a Medicare savings. This will help us as we go through because different rules apply depending on which program you are eligible for. Supplemental security income is basically available to individuals who are 65 and over automatically. If you are under age 65, you have to prove disability. It gives you a minimum monthly income, even if you have not paid into 40 quarters of Social Security. You apply for it at Social Security. If you are approved for SSI or supplemental security income, you automatically get Medicaid. And you only get Medicare Part A and B if you have paid into Social Security and have enough quarters, or if the state pays it for you. Adult Medicaid is often known as Obamacare. So if you are in this category, it's available to individuals who are age 18 to 64. You apply through Medicaid. You apply at Colorado Peak or through the exchange. And if you have adult Medicaid, you are not eligible for Medicare. If you are in the yellow box and you are either getting your care through Medicaid, it is important at age 65 that you disenroll from adult Medicaid and enroll in Medicare. If you are in the green box, you are in long-term care. And this means that you are receiving or you are going to apply for home and community-based services where Medicaid pays for someone to come into your home to take care of you on an intermittent basis, or you are going into an assisted living or an adult day program, or you are going into a nursing home. To qualify for long-term care, to be in the green box, you have to be eligible for nursing home level of care. That means that you need to have assistance in 2 of the following areas: dressing, toileting, bathing, mobility, transferring, or eating. And if you have deficits or you need help in 2 of those areas, or you need some kind of supervision of or oversight, then you only need to have 1 deficit in that area. That usually is how a lot of older adults can qualify for home and community-based services, especially because they are doing things like leaving the stove on, they're messing up their medications or whatever. To determine how these deficits are scored, you have to go through a functional assessment, 100.2, and that is done through the single entry point agency. And there are approximately 8 or 10 of those throughout the state of Colorado. You can Google single entry point Colorado, and the list will come up with the county in which you live, and then you contact that agency. You also have to apply and be approved financially, and you can do that through Colorado Peak online, or you can submit your application through the County Department of Human Services. The next way that you could become eligible for Medicaid is if you were in the purple box. And the purple box is the Program for All-Inclusive Care for the Elderly, or sometimes called PACE. And there are 4 or 5 agencies in Colorado that provide PACE services. Innovage in Denver and Fort Collins and in Colorado, or Pueblo. True in parts of Weld County and Boulder. True are Volunteers of America through Community in Montrose and Delta, and Rocky Mountain Health Services in Colorado Springs. So again, because it's an alternative to straight Medicaid, you have to be eligible for that same nursing home level of care. You have to meet those same deficits, but here the care is received from the PACE program. So the PACE program basically gets reimbursed a per member per month amount from both Medicare as well as from Medicaid. They then use those dollars to pay for services which include acute care, primary care, hospitalization, assisted living services, home care services. And you go to this adult day model under normal times, sometimes as many times as 4 or 5 days a week. You get your meals there. They can help with showering, a whole variety of services. Again, you have to meet both the same functional requirement at the county single entry point, as well as the financial requirements. If you are in the red box, and there are 3 different red boxes, and then each one of the red boxes has another discriminator. So if you are in the Medicare Savings Program and you are a QMB person, you have to have Medicare A and B, and this will assist you to pay for your Medicare deductibles, premiums, co-pays, and co-insurance. If you are in the QMB, although you get assistance, you do not qualify for Medicaid. You apply for this program through the County Department of Social Services, just like you do for Medicaid, and use the same application form. If you are in QMB Plus, that means that you meet the income requirements and these eligibility requirements, but you also now have Medicaid, usually under the green box, and you have met those requirements. The second part of the Medicare Savings Program is called SLIMB. Again, you have to have A and B, but all it pays for is the Medicare Part B premium, okay? It does not pay for any of the co-pays or any of the deductibles. Again, you don't have Medicaid, but you apply at the County Department of Human Services. If you have SLIMB Plus, that means, again, that you have qualified for Medicaid, usually through the long-term care service application process. The third part of the Medicare Savings Program is called QI1, and it is exactly the same if you will, as the SLIMB. However, the income requirements for you to qualify are greater, and so more people can receive services. Similarly, there's a QI1 plus, and here you get the same Medicaid coverage as before. Now, there's a special program which has nothing really to do with Medicaid, but it's important for you to know. And this is the Extra Help program. This is the assistance for prescription drugs. It's sometimes called the low-income subsidy. And if you qualify for Medicaid under any of the previous programs or the Medicare Savings Program, then you also are eligible for Extra Help. You do have to enroll in what they call a qualifying Part D plan. I'll explain that a little bit more later. You may have to pay a monthly premium or deductible. However, most of the time, if you're in Extra Help, those are paid for. And your co-pays are reduced to somewhere between less than $3.70 for generics and $9.20 for brand names. You do apply for Extra Help through Social Security. The next thing we want to look at very briefly is how do Medicare and Medicaid work together. So I've prepared a couple of charts. And again, over here, you can look on the left and you can see if you're in the blue, the yellow, the green, purple, or one of the red categories. You can look at the different ages in terms of how old you have to be to take advantage of this benefit. And in some of these, you need to be disabled. In the middle column, then, you do have to meet the income requirements. So for example, in order to get SSI, your monthly income from all sources as a single person has to be less than $794, and you have to have less than $2,000 in resources. If you are a couple, the income for both of you has to be less than $1,192, and your resources have to be less than $3,000. Resources basically include such things as cash in the bank, stocks, bonds, burial policies that have a cash value, and whole life insurance policies. What is exempt under resources is a house, a car, a term life insurance policy, and an irrevocable burial policy. So those are excluded resources and you're allowed to keep them. So as you go through here, if you self-identify which one of these groups you're in based on the income, then that will help you go to the next slide here, which is basically now we're going to look at how does Medicare and Medicaid combine or come together. Again, we're following the same color coding system. So if you are on SSI and you have Social Security, then you automatically have Medicare, parts A and B, and your premiums are paid. Similarly, if you have A and B, your deductibles are paid by Medicaid. And if you are on Medicaid, your co-insurance and your co-pays are paid. Now, sometimes you will find that for certain services, these co-pays, you may owe a minimal amount of money. Like you may owe $3 for an office visit, or you may owe $50 for an ambulance transport to a hospital. So again, as you can see, Medicaid, it basically will help pay for the premiums of A and B in all of these programs, but adult Medicaid. And the reason for that is because you can't get Medicaid or Medicare under age 64 unless you are disabled. And if you are disabled, then you get Medicare by virtue of having Social Security. The next one we want to look at here a little bit is who pays, Medicare or does Medicaid pay? So we have Medicare Parts A and B, Part C, which is Medicare Advantage, Part D, which is prescription drugs, and then over here is Medicaid, and then the extra help or prescription drugs. So back to our example, if we are an SSI and we have Social Security, then Medicaid is going to pay for parts A and B, or Medicare. Part C is optional, and Part D, we are going to get some assistance through the Extra Help program. So the Part D and the Extra Help should all be the same here. So Medicaid doesn't directly pay, but Extra Help pays if you need a Part D or prescriptions. As you can see under Part C, for all of these different areas that you might be eligible for, is optional, except in the PACE program. In the PACE program, basically, your A and B parts are paid for as part of the PACE, because we said it pays for hospitalization and skilled rehab services. You do not need a Part C because they function very similar to a Part C. The Part D, or the prescription drug, is included in the enrollment, and you don't pay anything. There's no out-of-pocket to enroll in the PACE program. And then they get reimbursed on the per member per month. The next thing we want to look at is, as we said, Medicare Advantage was optional, but for some people it makes sense. So the first thing we want to look at is the special needs plans. And there are 3 types of special needs plans currently offered in Colorado. There is a dual special needs plan, or a DSNP. There is an institutional special needs plan, or an ISNP, and then there is one that covers chronic or disabling conditions. So a special needs plan pays for acute care, primary care, prescription, durable medical equipment, all of the services that you basically would need. They have a very high focus on case management, making sure that you get the services that you need when you need them in the correct setting. It's available to you if you have both Medicare Part A and B, and you have to be eligible for Medicaid. If you're not currently receiving Medicaid and you want to enroll in a special needs plan, you first will have to do the financial determination at any of the county departments of human services through Colorado Peak. The eligibility for a DSNP and an ISNP is exactly the same. So basically, you have to be eligible for Medicare Parts A and B. You have to be receiving Medicaid, and you get what's called a special enrollment period, meaning that you can sign up anytime during the year that you are eligible or you decide you want those services. You can change your special needs plan once a quarter. So there are a number of providers in Colorado. Say you're with Kaiser and you want to change to a United plan, you can make one change in the first quarter, one in the second quarter, and one in the third quarter of the year. The costs for a special needs plan, most of the time the premiums are waived. The co-pays vary. And you are eligible through the Extra Help for the prescription drug plan. It is embedded within this special needs plan. The benefits, basically, they vary with plan and they vary from year to year. So just because you enrolled in a DSNP or an ISNP this year doesn't mean that you will be getting the same benefits or the same pricing the following year. Premiums usually are zero, but not always. They focus on care coordination. Many times they offer additional benefits, and those include things like an embedded, limited, usually vision, hearing, or dental program. They may offer over-the-counter drugs, medical supplies, and other kinds of services, transportation. They do qualify for telehealth services, and they may include gym memberships. So what is the real difference between an I-SNP and a D-SNP? An I-SNP means that you are in an institution. So you have to live either in an assisted living or a nursing home to take advantage of these services. Not all nursing homes in Colorado or assisted livings participate. They're not available in all markets. So they're pretty well available in the Metro Denver market, but not necessarily outside of Metro Denver. Not a lot of assisted living residents participate either. They do use a model where you have nurse practitioners who focus on providing care within the institutional setting. They try to avoid hospital transfers as much as possible, and they do work with an integrated team of nurses, therapists, social workers, physicians, pharmacists. They also work very hard at coordinating your care with the staff at the either nursing home or assisted living where you live. On a D-SNP, or a dual special needs plan, basically you live in the community. You live in your own home or apartment. Care coordination here is also a big focus. The idea, again, is to reduce institutionalization. They too are not available in all markets, so you may very well want to take advantage of this, but it may not be offered in the zip code in which you live. They too use a team to deliver integrated care. The chronic or disabling condition one is, there's only one available in Colorado. So the companies that offer D-SNPs in Colorado are basically identified in this chart. If there is 1 star, that means that they also offer an institutional or an I-SNP. So some of them offer chronic disease and some offer I-SNPs. Who can enroll in a Part C? So now we are back to looking at the different color-coded groups. So you have self-identified as to whether or not you are a dual or a D-SNP, or whether you can enroll in an I-SNP. So if you look at these 2 columns here, you will find that, again, you can self-identify whether or not you are eligible for any of these programs. Now, the next big question becomes, if you are in a D-SNP or an I-SNP, then to do that, you take advantage of the Medicare, or you use a Medicare Advantage plan, because the D-SNPs and the I-SNPs are offered by Medicare Advantage. So if you enroll in one of these, then you are also enrolling in a Medicare Advantage plan. If you, for some reason or other, decide not to enroll in a Medicare Advantage plan, because you, and a D-SNP or an I-SNP, and you may want the freedom that a Medicare supplement provides you in terms of being able to use, have more flexibility in who you see as providers, you can do that. Now let's take a look down here. So PACE is not available to any of these, okay? Long-term care, you could get either a D-SNP or you can get an I-SNP, depending on where you are. Probably don't need an additional Medicare Advantage or a Medicare supplement. Where this really becomes important is if you are in the red boxes. So if you are in these plus programs, you are on Medicaid. And you then can decide whether or not you want to sign up for a Medicare Advantage. You will not need a Medicare supplement if you are a plus person. If you are not a plus person, you're a QMB, SLIMB, or a QI1, then you are not going to be eligible for either the D-SNP or the I-SNP. So you may very well want to consider signing up for a Medicare Advantage or a Medicare supplement. This is true for QMB, SLIMB, and QI1. The Medicare Advantage plan for you usually offers lower premiums, and they may assist then with the Part B out-of-pocket expenses, as well as deductibles. If you're a QMB, if you're a SlimB or a QI1, you're only going to get assistance with the premium. The Medicare Advantage then gives you access and gives you some additional coverage through the Medicare Advantage plans. If you do not want to enroll in a Medicare Advantage, you may want to consider enrolling in a Medicare supplement. That has a higher premium, and depending on which one you enroll in, it may cover all of your A, B expenses. We did do a lunch and learn on the difference between Medicare Advantage and Medicare Supplement, and I would invite you to review that. We're just going to do a quick overview of the difference between Medicare Advantage and a Medicare Supplement if you do not qualify. So the difference of a Medicare Advantage versus a Medicare Supplement is that premiums are lower in a Medicare Advantage. In a Medicare Supplement, you have a guaranteed enrollment at age 65. A Medicare Supplement has to take you regardless. Many of the Part B costs on a Medicare Advantage, such as oxygen, durable medical equipment, ambulances, those have either copays or out-of-pocket expenses covered in most Medicare supplements. You usually have to use a contracted physician or specialist hospitals in a Medicare Advantage. In a Medicare Supplement, you can go where you want. Medicare Advantage does cap your out-of-pocket expenses. It's not necessary in Medicare supplements because if Medicare pays, then the supplement has to pay. In a Medicare Advantage, the Part D or prescription drugs are embedded, and you have to buy a separate Part D plan if you're in a Medicare supplement. The companies in 2021 that are offering Medicare Advantage plans are these 9, and they are very competitive as well. These are the companies in Colorado that are selling a Plan G in 2021, and the benefits are the same across companies, Plan A, B, C, D. Whereas in a Medicare Advantage plan, the benefits are similar for original Medicare, but then the additional benefits vary by plan, as do the costs. We're going to take a few minutes now and look at prescription drugs, or Part D. It's coverage that is offered through a private insurance plan. You do have to enroll between now and December 7th, 2020, with coverage to start January 1. You do have to change plans if your plan does not participate in extra help and you're on Medicaid. And the way you can figure that out is you check the plan finder to see what prescriptions are being covered, whether the company is participating in extra help, and to minimize your out-of-pocket expenses, especially if you are in a Medicare supplement QMB. So the qualifications for extra help or low-income subsidy. Again, if your income is less than $19,140 for a single person or $25,000 for a couple, these qualifications are significantly higher than for Medicare, the Medicare Savings Program. Similarly, the resources are significantly higher. Extra help has 2 parts, a full and a partial. And under a partial, you do have some out-of-pocket expenses. On a full, more of the costs are paid. You apply at Social Security, either online, or you can call their 800 number at 1-800-772-1213. If you are receiving Medicaid or the Medicare Savings Program, you will be automatically enrolled in the extra help, and you can get this assistance without getting Medicaid. Now, how do I know which companies provide me a benchmark plan or pay for pretty much everything under my Part D plan, regardless of which box I am in? So most of them are noted, and they have a zero premium, zero deductible, and you have no obligation in the coverage gap. You can enroll anytime during the year if you're eligible for Medicare and Medicaid, but you should enroll sooner than later if you're eligible for those programs. The Part D standard benefit then is basically you have an annual deductible of $445, and if you're on extra help, you don't pay anything. The initial coverage limit, you pay 25%, or about $1,000 out of $4,000 of cost at the retail level. If you're on extra help, you pay zero. In the coverage gap or the donut hole, you pay 25% for generics and 25% for brand name drugs, when the total cost of all of these up here reach about $10,000. Again, if you're on extra help, you pay zero. And then once the cost of your drugs gets to the catastrophic level, basically then you are eligible under extra help again for $3.60 for generics and $9.70 for brand. These are the companies that are offering Part D plans in Colorado. The ones with the asterisk have one plan or more that is an extra help plan. They also have a number of plans that are not participating in extra help. So make sure that if you are looking for an extra help, that you sign up for the correct plan. So that concludes our conversation today on Medicare and Medicaid and how you would apply for assistance. Where do you go to get help? You can call our office. We have a number of resources that might be of interest to you. You can request a goodie bag by putting your name, address, and telephone number in by sending us an email at cogs@senioranswers.org. Do not put your name, address, and telephone number in the chat, but rather send us an email. You can also, on November the 16th, you could get more information on Medicare on the Porch. You can do a drive-by, pull into the driveway and just grab a bag and go. You can get one at Holly Creek at 5500 East Peakview Avenue, Centennial, or you can come by our offices at 1129 Pennsylvania here in Denver. Other things that we have in our toolkit, we do offer individual counseling. You can call us about coverage. You can call us about whether or not you should enroll in a Medicare Advantage or a Medicare supplement. We can help you to enroll at Social Security if you think you're eligible for Part D. We can also help you with your application for Medicaid if you think you are eligible for one of those programs, or if you need assistance with the Medicare Savings Program. We can also help you walk through the plan finder. You will need the name of your drugs, the quantity that you are taking, and the frequency. Other things in the toolkit is we highly recommend that you visit Medicare's website at medicare.gov. At medicare.gov, you will also see that's where they have the plan finder. Another thing you should do at medicare.gov is open up the mymedicare.gov account. This will help you to track all of your Medicare services, such as whether or not you're enrolled in extra help, how much your plan has paid, whether or not you're enrolled in Medicare Savings, gives you your preventive services history. So there's a lot of good information that is tracked there. Lastly, we also have available either through a link or in the goodie bags, a copy of the Medicare Drug Insurance and You pamphlet that is put out by the Colorado Division of Insurance through the Senior Health Insurance Counseling Program. There are virtual copies available on the link on this website as well. Other resources in our toolkit is you can visit with representatives from our sponsors today, including Humana, Integrity Insurance, and Kaiser. If you want a complete list of the Medicare Advantage plans, Medicare supplements, or the prescription drug plans, you can also get that at medicare.gov. And with that now, I would like to invite you to join us in the expo. You can, as I indicated earlier, click on the bar on the left-hand side of your screen, click on this little tent that says Expo. When it lights up, you will know that you are in the expo. Click on the outside of the booth where the logos are, and that will then give you admission to the booth itself and the representatives who are providing information today. I will join you at the expo in the Colorado Gerontological Society's booth momentarily. Thank you all for joining us today. If you have any questions, please feel free to give us a call at 303-333-3482. If you need assistance in Spanish, please call us and our Director of Latino Services will help you. Our counselors are also standing by and can help you at this time or any time between now and December 7th. You can also send us an email at cogs@senioranswers.org. On behalf of the Colorado Gerontological Society, I would like to thank you for your attention today and hope that you have found this particular program helpful.